Mr. President, I rise today to honor the incredible life and legacy of Julie Beckett, a champion for individuals who experience disabilities and their families. In 1978, Julie's daughter Katie was born, and 4 months later, Katie contracted a brain infection that left her paralyzed and on a ventilator. After 2 years of living in a hospital, Katie's family had reached the limit on their health insurance policy and applied for support through Medicaid, but were told that Medicaid would not cover at-home care. Julie and her husband Mark knew that they did not want their daughter growing up in a hospital, especially when she could receive the care that she needed at home while also being with her loved ones. Faced with uncertainty and with federal officials who would not make an exception, Julie reached out to her congressman. Julie noted that making this exception for her daughter would not only be good for her family, but also that keeping her at home rather than at a hospital would cost the government far less money. Julie's advocacy worked. Because she made the choice to speak up and share her story, Congress passed and President Reagan signed into law an exception to Medicaid rules that enabled Julie's family and many others to care for their loved ones at home. Julie's work has had a profound impact on not just her own family, but countless others, including my own. My son, Ben, experiences severe physical disabilities, and because of Julie's advocacy, he could grow up at home and with family. And because he was able to live at home, Ben had the opportunity to go to school, to learn, and make friends in our community. The terrible reality is that before Julie, many children grew up in hospitals or in institutionalized care, instead of surrounded by the love and care of their parents, siblings, and neighbors. But my family's story is not unique. In the decades since, what is now known as the Katie Beckett waiver has changed hundreds of thousands of lives. More than 500,000 children have received these waivers, and they've been able to live, grow, and thrive at home. Julie's story is an example of how one person can make a true difference in our democracy. And even after her successful work in securing the significant exception for Medicaid, Julie kept fighting for children who experience disabilities. She helped lead a charge to expand coverage and fought against attempts to repeal the Affordable Care Act. And critically, she worked with families throughout the country to show them how they could be advocates as well. Julie passed away last month, but her legacy will live on in the lives that she's changed and the advocacy that she helped to inspire. I am profoundly grateful for her work, and I join with people across the country in committing to carrying on her legacy of fighting to fully include people with disabilities in every facet of American life. Thank you, Mr. President. I yield the floor.